Good morning, everybody. Uh, Thank you for joining us and welcome today to our webinar, Coronavirus and Pandemic Planning, Ask the Experts. So the reason we wanted to put this webinar on this morning is that obviously this is a very dynamic situation. It's something that's affecting us all, and there's a great deal of advice, recommendations, and frankly, quite a lot of noise. And we've found, certainly from working with customers, that it can be quite difficult to know what the right thing to do in this situation is. Now, a lot of businesses don't have a dedicated business continuity professional, so it's difficult to be able to ask an expert and find out what the right thing to be doing is. We obviously have a team of experts here, so we thought probably the best way that we could provide as much value as we can to as many would be to put on a quick session here, answer any questions and see what we can do for you all. I'll run through very quickly now what we've got scheduled for today. So the duration of this webinar is 40 minutes. If you've been on any of our webinars in the past, perhaps heard from me, you'll know I'm a big stickler for time. I really appreciate when we can kind of keep these to time. We will do our best to go through and answer all of the questions in that time. If there's any that we don't manage to get through, then what we'll do is we'll try to write things up. We'll try to do a wash up after this and forward on any questions that were unanswered, any more advice that we can give. And on that topic, the slides, although the slides aren't particularly exciting today, will be distributed after this, and in particular the recording of this webinar will be distributed. We've already had a chunk of questions through from you so far. So when folk were registering for the webinar, they were filling in their questions in the form. Terrific. So we've got a long list already, but we have the facility to be able to answer questions as we work through today. So on the right-hand side on your panel, you should see a section for questions. Please type any questions you have in there. We'll try to work through each of those. As I say, anything that we don't manage to get to today, we'll do our best to kind of get back to everyone afterwards. In addition, we have a couple of handouts that you can download. Now, as I've said, because there's a lot of noise and there's a lot of advice, we've wanted to keep this to an absolute minimum. So just a couple of things that we think are really useful. So we've got some advice for employers from ACAS, and we've got an awareness poster, something that perhaps you've already seen, but it's a really good item to download and get printed up and put up in the office. Additionally, we have a couple of links to useful resources that we have at the end that we'll distribute on email after this session. So I'm going to give you a quick introduction to who it is that you're going to be hearing from today, so our panel of experts. So first up, we have Bob Causey. So Bob is the leader of our business continuity practice here. He's the chap that runs business continuity as a service for us, that goes out and runs business continuity for our clients. Lots of experience from lots of different organizations, but including Thomson Reuters and working currently with law firms and distribution companies. So kind of lots of good experience there. Richard is our second panelist. So Richard is one of the kind of pioneering practitioners of business continuity with kind of 30+ years of experience, originally starting at London Transport, leading the recovery of bus garages, but has since been working in some of the large international banks and has some good interesting experience around dealing with previous outbreaks and pandemics in the past. Third on our list is Julie Goddard. So Julie has recently joined us and has a long kind of list of past experience working in both in councils, working in food and drink, and then most recently working for the Solicitors Regulation Authority, managing business continuity for them. And our final panelist is Mike Osborne. So Mike's our non-executive director, and he's got very well known in business continuity world. He's run some of the largest work area recovery companies in the UK. He's an inaugural chair of the Recovery Site Providers Group, works with the Scottish Continuity Group. So the reason I'm kind of giving this background is just to say this is a group of people who have been through this before, kind of know what to expect, and hopefully can give some sensible, reasonable advice for everyone today on the call. Now, before I jump into everyone's questions, I've got a couple of things that I want to just put to our team here to kind of set the scene and get us started. And so I'm going to start with Richard. I'll put this question to you. So what have you learned in the past from responses to things like SARS, avian flu, Ebola, etc., everything else that you've kind of come across in the past?
Yes, thank you, James. So SARS was really the thing that kicked all this off. Confined very much to Asia, where I was working at the time, and everybody realized that remote working capability, working from home, just wasn't available at that point. So we saw the introduction of split operations, so dividing the workforce into two and having mirrored operations in two separate buildings where you were able to do that. So that's how most of the financial services companies proceeded at that point. And we also saw the introduction of face masks. And the reason that that was introduced for SARS was it was given to people who were ill with SARS. We'll come back to this as a topic later on, I'm sure, but that's the original reason and the most valid reason for giving somebody a face mask. In terms of other things that I've been involved with, so back in 2006, I took part in the Bank of England's market-wide exercise where we modelled a pandemic over a 6-week period, and some 70 organisations took part in that. And that really helped to inform the way that the planning in terms of response to pandemic has been taken forward over that time. So we're seeing lots of improvements as a result of experiencing pandemics, both in a business continuity sense, but also, of course, in the sense of the medical response to that and the way that everything comes together. So I think looking back over the last 20 odd years, that would be the thing that I would take away at this point.
Perfect. Thanks. And I'll put the same question to you, Julie. Obviously, I know that you've been through this in several different organisations. So what were your learnings from those situations?
Yeah, hi, thanks, James. So I dealt with avian flu, swine flu, and Ebola actually when I was at the county council. I think there's two big lessons which come out for me. One, the first thing, and you'll already be aware of this, I'm sure, is managing the fear. And some of that fear is whipped up by the media wording and their communications, which tend to be quite emotive. And it's really important internally that you send out calm communication, which is proportionate and it is based on official advice. And I'm not suggesting for one moment that, you know, that I'm not undermining the fact that this is a fearful situation, but it is important to keep the communication calm. The other lesson that I suppose I learned from it is that it's really important to, in advance, identify where you've got single or limited points of expertise in your organisation, such if those people were taken ill, unable to come to site, that you've got other staff that can step into that role. And so cross-skilling of staff and making sure you've got a good skills matrix, identifying where you've got any gaps is important, and you should do that as soon as possible. And obviously that might need some cross-training as well, documentation and so on. And I think the other thing that I learned from those situations that I dealt with was that it's really important that line managers understand that they have a duty of care for staff. Obviously HR and health and safety and the incident team are there as well. They are driving the incident and supporting the incident. But notwithstanding that, the managers do still have a duty of care for their own teams and taking support and advice from HR as and when required. So I think they're the things that came out from me for those from those particular experiences I had.
Lovely, thanks, Julie. So Mike, I've got a question for you, and this is so I've seen obviously you've posted some advice on LinkedIn based on kind of previous learning. So what do you think businesses should be doing right now? What should they be doing to make the situation better?
Morning, James. Morning, everyone. I think I'll answer that question just very shortly, but I think just to reflect, what we're hearing already is whilst COVID-19 is a new virus for us to respond to, planning for pandemics isn't something that's new within the business continuity professionals industry. Richard just mentioned in 2006, I think it was, a 6-week market-wide exercise was run on pandemic planning, and that was in the context of bird flu and swine flu, etc. That was a concern at that point in time. And I think it's easy to sort of forget the fact that these sorts of things have happened before, and there were lessons learned, and experts can reflect on that, but only if they're around at a time. And of course, 2006, 14, 15 years ago, if you're in your mid-30s now, you probably would have been still at university back then. So it is a new strain, but it's not a new challenge for us. So to answer your question, the first thing you have to do is to protect your staff. And as a business, I think there's lots of initial thoughts around how you continue to deliver your service, what your obligations are, whether there's liabilities from not being able to deliver the service. But the first thing that you need to do is to protect your staff. You have to look at the underlying health issues that you might have within your organisation, the age demographics within your organisation. So think about protecting staff first and foremost. What you then need to do is to start to think about how you mitigate the risks to the business. And obviously on this webinar, we'll talk further about this. You can't do it in isolation. You need to get your exec together. You need to get your senior leadership team together and really start to desktop through all of the things that you think might be at risk if you lose staff. Now, I think the other thing that Richard and I were talking about earlier, and he reminded me, that market-wide exercise lasted 6 weeks, and it modelled peak and prolonged impact. And I think it would be easy for firms to think, right, 14 days of self-isolation, I need to think about this in a relatively short-term impact on my business. And of course, the reality is that if you've got cross-infection between team members in the same office, multiple offices around the UK or indeed around the world, this may play out over several months. And therefore, you need to think not only about short-term risk, you need to think about a long-term, prolonged rolling impact across the organisation. So those are the three things. Think about staff, think about mitigating the risk, but also think about peaks and prolonged period of impact.
Lovely, thank you. And then to Bob, I'll pop this one to you. So what phases or stages of response should an organisation have?
Morning, James. Morning, everybody. Thank you very much. Yes, as we've already heard from the guys, really risk analysis and understanding what your risk is. But we did an exercise yesterday with the charity IT leaders, and one of the key things that came out of that was knowing your strategy. What is it you're trying to do? So for some companies, for instance, where you've got mobile workers and you're very used to doing remote working, then that may inform your strategy. However, if you've got shop fronts or you need to, you don't have that capability for remote working, then that will determine what your strategy is going to be. Once you've determined your strategy, then it needs to be centered around your staff. What are you going to do for your staff? Making sure you protect your staff, but also protect your business as well. As Mike just said, this may actually play out over some time. So what you really need to consider is how best to ensure your staff are in the right place at the right time throughout the process. And then also communication. What are the various methods of communication you're going to use? How can you make sure that your staff actually hear that communication? Also your suppliers and your customers as well, and key stakeholders. Prepare that communication ahead of time, and as Julie said, that will help to take the emotive factor out of that communication and make sure that it's clear and concise. And then really it's just a matter of, as Mike said, making sure you've got the right people to make the right decisions going forwards at every step of the situation as well. So your strategy may decide that you start with a softly approach with few people out of the office. It may then transpire that you decide that a few more people, you split the workforce 50-50 somehow, whichever way that's going to be, and then it may well be that everybody is out of the office, and then what happens? What do you do with the post? What do you do with your suppliers, the coffee that's being delivered, that sort of thing. So yes, make sure you've got that forum meeting regularly to go through the whole of the process. Thank you.
Brilliant. And then, so look, put this to you, Mike, then. I think you sort of touched upon this before, but how do you balance the needs? Obviously, you talked about staff welfare and safety with your other obligation, which is to keep the business running and making money.
There are only a few things that owners and directors of companies can be jailed for. Fraud is one of them, obviously, but the other one is corporate manslaughter in terms of health and safety breaches. And I'm not being an alarmist there, but that really does, I think, bring into focus the fact that you really do need to put your people first. So as an example, if you've got a professional services business where you're going out to clients' offices, you're asking your staff to go out of your environment into someone else's environment. And if that environment has declared the fact that they've had an infection, what do you do? Can you insist that your staff walk through the door, knowingly put themselves at risk? Now, they might be willing to do that, but then they go home, they've got a young family, maybe they have caught the virus and they infect their family, or they come back into your office and infect your office with the ramifications that has. So, you've really got to start to think about what you're asking your staff to do. And from a health and safety point of view, is it reasonable to ask them to do that, or are you putting them in any form of risk? And I know that has, really widespread connotations, but people need to realise that under health and safety obligations, whether it be moral or legal, those are the sorts of things that you need to be thinking of. So what you need to do once you've realised that there's that scope of potential impact is how you can mitigate it. So what can you do using technology? Is there anything you can do remotely, connecting into organisations rather than having to go there physically? Or if you can't do that and the service is absolutely fundamental to the client, work on a way as to how you can get your staff in there securely and safely, but by mitigating the potential for them to be infected. So you just really need to think those things through, look at the alternatives, and if there aren't any alternatives and it absolutely has to be done, then think about how you might be able to mitigate someone going into that environment.
Great, thank you. Bob, I'm going to put this one to you. So what trigger points do you need, what trigger points do you recommend for cascading status changes to staff? And maybe perhaps in your answer, if you could perhaps explain some of that terminology for perhaps for any folks that don't understand trigger points and cascading staff changes.
Sure. So I guess the best trigger points that we've got are those that are being provided by Public Health England and the government at the moment. So they've got a 4-stage implementation: containment, delay, mitigation, and also research, which is running along all of those things. So research obviously doesn't impact us as something that we will use as we go through. But containment is effectively where we are with the government at the moment. They are suggesting that we wash our hands, that we don't go to meetings where necessary, and those sorts of things. But they're not actually saying that we shouldn't gather or go to concerts or whatever it happens to be at the moment. We're just in the containment phase. And the next point for cascading really, and that will have that containment phase. You should be communicating with your staff, telling them what your strategy is going to be with regard to when we go through the remaining phases. The next phase that the government will inform us of is delay. And this will be measures to reduce the rate and the extent of the spread. So we will have population distancing. So schools will start to close potentially. People will be encouraged not to go, or they'll probably close public events and that sort of thing. And also there'll be a lot more requests for people to work from home. So now this will be obviously the next cascade, and this should be prepared for. You should know how you're going to ask people to work from home, if you can ask people to work from home, or indeed whether you need to do a strategy where you get half the people coming in one week and the other half coming in another week, with a deep clean in between. So that you actually minimise the amount of people that are being contacted. You can spread them out on the shop floor, whatever it happens to be. But you know, this is a strategy that needs to be determined, and then mitigate. And hopefully we don't get to that point. We've seen that with Italy, and of course that needs to be told to the staff as well, communicated out to everybody what's going to happen in that phase. And one of the key things going through all of that as well is making sure that your staff are in constant communication with each other. One, so that you know that the business is being run correctly, but also you're in touch with them from a personal point of view to make sure that they're still safe and they're still okay, and they're not going stir crazy if they're working from home, for instance. So those are the key stages. We should follow the government's advice and react on that. You may want to get ahead of the curve on some of these things and start to test that people can work from home if that's what your strategy decides, or that you can do the split working before we actually have to go into that particular phase. But yeah, those are the stages that we ought to be following, I believe.
Brilliant, thank you. Mike, I'm going to put this to you. This one's an interesting question. I think it's probably what everyone's thinking. So should there be a point at which you ignore advice and restore normal working in full or part to keep a business functioning, or should you stick to the advice, potentially stopping all business activity?
You'd be going into really dangerous territory to ignore government advice, and it comes back to that comment. And I know, as I said at the time, it might have been alarmist, but if you're going to ignore either World Health Authority or government advice on what you should be doing, then in terms of any potential impact should someone die as a consequence of you ignoring that advice, you're just leading yourself open to prosecution, to be frank. Now, we're all concerned, but equally we're all trying to get this right balance between, is this just a really virulent, nasty virus that is particularly harmful to a sector of the community, underlying health issues and those over a certain age, versus still trying to carry on with doing the work that we all need to do. So I think my advice wouldn't be to directly ignore any government or WHO advice, but be pragmatic. Don't be alarmist. Take a sensible, balanced approach to trying to do as much as you can and mitigate as many of the risks as you possibly can do. And by doing that, whether it be working from home, using video conferencing, using other technologies, to carry on doing as much as you possibly can without putting your employees, your suppliers and your broader stakeholders at risk.
Thanks, Mike. Okay, Julie, a question for you. What should we say to staff who have symptoms? At what point should we also isolate others, just their team or the entire floor or the entire company?
So if someone exhibits symptoms at work, the first thing I think you need to do is lead them to a meeting area, a meeting room with a closed door away from others. Obviously then you're going to ask them to go home and self-isolate. It's important that you point them to some official guidance, and there's actually something on the Public Health England called Stay at Home Guidance for People with Confirmed or Possible Coronavirus Infection. So I would point them to that as well. As of yesterday, the government were asking people not to call 111 unless they are concerned about the condition because it's deteriorating or because it's going on longer than expected. It's important they look at the right guidance. You also have to tell them that you will have to inform other employees that they have become ill, and you have a duty of care to do that, because we should be completely transparent, and they will need to understand that other staff will need to be told they've gone home with potential coronavirus, making it clear it's possibly not tested and confirmed. In terms of isolating the other parts of the organisation, I think that's a real judgment call. A bit of common sense is needed, because if you imagine that person's come in through a front door and they've touched door handles, presumably everyone else has touched door handles as well. If they've been into the loos, if they've been into general areas that other people use, kitchens and so on. So I think you have to take a view on based on what you know about that person, where they've been, as to whether you also need to send others home. You also need to be aware of vulnerable staff on site. They obviously, everyone's life is important, but the HR teams should try and make, as far as possible, themselves aware of vulnerable staff. Now, it's important to point out that you don't have to tell your manager or HR or anyone if you have a condition, an underlying condition. That's your prerogative. So it is about those that we know about. There may be people we don't know about. But I do think, in terms of isolating the whole company, as I say, it needs a bit of common sense and a bit of consideration as to whether that is the right thing to do. But be assured that if once you've told staff on site that someone has gone home with potential symptoms, it will generate some concern and questions pretty quickly from them. So you need to get that communication out in terms of what you're going to do next fairly quickly, because otherwise people will start making stuff up and they will start talking to each other, and you'll start to lose control of the situation. So yeah, some very careful management needed, and very careful direction from your incident team when that happens.
I've got another question here. I'll keep this with you, Julie. So this is also about isolating staff. Would you recommend isolating staff returning from overseas travel, but not on the government list? So I think this means countries like the USA, not like China or Italy, for instance, at the moment.
Yeah. Well, obviously the government advice doesn't say that you have to isolate if you've come from a low-risk country. But personally, I've just come back from Switzerland, and I went through the airport and various other transport hubs where I potentially have been in touch with people from other countries that are high risk. I think that's quite a difficult one to answer, because it's a changing picture. I wouldn't want to encourage all staff to go home, from anywhere that they've travelled, even if it's low risk. But I suppose the main thing is, if they start exhibiting any symptoms at all, then go home. Doesn't matter where you've travelled, even within our own country. So I think it comes back to what's happening. Has that person got symptoms? Send them home if necessary. I think that's the answer.
Great. Yeah, thank you. I'll pop to, so next question I have, I'll put to you, Richard, because I know you're the face mask expert. Should we buy face masks for staff travel?
Yes, so the answer to that is absolutely no. So for the avian flu pandemic, I was in a situation where I had to buy several million face masks, and all of those several million face masks ended up in landfill. Because we were unable to issue them, because for the majority of people, unless you've been trained how to put the mask on and how to take it off, you are more likely to infect yourself by wearing a face mask than not. And the simple reason for that is that the way that you introduce the virus into your system is through your eyes, your nose and your mouth. Now, obviously the mask covers the mouth, but it certainly doesn't cover the eyes, and because you're wearing something and they become very uncomfortable. I made a member of my team wear a mask all day, and they actually lasted about 2 hours, because by that point it got so soggy that they said, you know, Richard, I can't cope with this, I'm going to take it off. And that was just an experiment to prove a point, or to illustrate a point. So no, there's no point in doing that. Face masks are for medical professionals that need to be wearing protective equipment. They are for people that have been issued them under medical instruction. There's no point in issuing them to the staff.
Perfect. Yeah, thanks. And anything to add on that, Julie?
Yeah, just something that people might like to be aware of if they've not found it already. On the World Health Organization's website, there's a really useful link called When to Use a Mask and How to Fit It and How to Dispose of It. So it's worth having a look at that, because that's the official advice on use of a mask. And just to reiterate what Richard was saying, it's important that people don't think that everyone has to go around wearing a mask, because that's not helpful and actually can make the situation worse if the mask isn't fitted properly and it acts as a reservoir for germs to gather and multiply. So, but I would point people to the World Health Organization, when to use a mask, how to fit it and how to dispose of it.
I have a follow-on question for this one. I'll put back to you, Richard. Should we buy contactless thermometers? Assuming this is to test all staff.
Yeah, before I answer that one, let me just add one other somewhat amusing point. But as a long-standing beard wearer, I have to say that I would have to shave it off if I wanted to wear a mask and have a good fit. And you will find that certainly amongst the ambulance service, because this was mentioned on my local radio this morning, their staff are being encouraged to shave their beards off so that they can actually wear the masks. In terms of the thermometer, the contactless thermometer, yes, that is an appropriate measure if you are thinking about preventing people coming into your premises because you're concerned that they might be infected, and you haven't got really any other way of telling other than that they're displaying an elevated temperature, which breaches the government guidance. So there are some problems around that, because obviously it's asking the people on your reception or your security team to do this particular task, and you don't know how the person that's being requested to have their temperature taken is going to react to that. So it's not an easy thing to do from a practical perspective, but if you really feel that you need to do that, and we're seeing that with some of the bingo establishments, they are implementing that already, then you could do it.
Great, thank you for that. I'll come to you, Julie, for this one. How should we classify different groups of staff, those with existing health issues, dependents, parents who might be affected by school closure? How many groups is sensible?
Well, I think the ones you've just touched on, the vulnerable staff, as I say, assuming you know who they are, pregnant ladies, parents you've touched on, those with caring responsibilities. I also think you need to, and that's obviously all around staff duty of care. I do think you also need to, within your incident team, make sure you have deputies, and also within your specialist support teams, people like IT that support remote working, facilities that look after the building, the cleaning regime and so on, health and safety. Make sure that they have, there is enough support within each of those teams as well. Because obviously just because you're managing the situation and involved in the response doesn't mean that you're immune from it. So you also need to look at your internal teams and make sure you've identified which groups you need to make sure you have deputies for. And it goes back to my earlier point actually about cross-skilling and upskilling and making sure that you've got enough skills on the ground to manage this situation.
Great, thank you. Mike, I'll come to you for this one. We have several staff who are particularly worried. We're making changes to our working practices but don't want to scaremonger. How should we limit concern?
Look, I can't believe that anyone that listens to a radio, watches television, or reads a newspaper isn't currently being bombarded with this. So to Julie's point earlier, if you don't converse with your staff, then they'll make their own minds up. So you can't stay silent. You need to constantly update people. I would suggest at least twice a week, and then if there's any updates from the government, respond to that really quite quickly within your organisation with messages. But also make sure that your employees can talk to someone. You know, if they've got a concern, Julie's quite right, there are people with underlying health issues that you're not aware of. They need to be able to say, well, actually, this is the point that I need to go to someone confidential and talk about my concerns, and have the company work through with me an appropriate response now that they have got the knowledge of why I'm concerned. So communicate effectively, regularly, and make sure that your employees have got an internal confidential contact to be able to discuss any concerns that they've got, either for them, but also for people at home living with elderly relatives, or having, you know, pregnant wives, etc. All of those things people might want to discuss on a confidential basis.
Great, thank you. So we've got 5 minutes left, so we still have quite a few questions to run through. So I'll ask if we try to do a kind of rapid fire answers on these as much as is possible. Next question goes to Richard. Should we advise staff not to travel on public transport?
Most people have to commute, so they just need to take some precautions, wear gloves, and then make sure that they wash their hands once they get to work. Oh, and don't eat on public transport. Don't have your McDonald's while you're traveling on public transport. That way you won't ingest the virus.
Great. Another one on travel here. I'll put this to you, Mike. Can we request a ban on personal travel or limit staff going to large events?
Within your own work environment, you can set whatever policies you want, but as soon as people walk out of the door, whilst your obligations don't end, your ability to tell them what to do pretty much end. So you can't tell people not to do stuff, but you can give them strong advice through your communications that you would strongly advise them not to do things. However, what you can do is to ask them to report stuff. So if you say, look, we can't stop you doing this, we recommend that you don't, but if you do, you must tell your line manager that you've done it, and we can do a risk assessment as to whether or not we feel that having done that, you pose a risk to your colleagues, and therefore we need to take some actions against it. You can't stop it, you can force them to report it.
Great, thanks. Bob, I'll come to you for this one. How long will travel restrictions last?
Yes, well, there's a good one. I guess UK Health or Health UK will, and the government will have something to say about that, but also the risk assessment that Mike just mentioned, that should be taken into consideration as well. So, you know, whether you need to have people travelling or people are ill, and therefore how much buffer do you put around that, but that should be determined, you know, by the government and or your risk assessment.
Great. Mike, I've got one here on remote working that I'll put to you. Not all staff have company-owned laptops. To date, we have only allowed access on company-owned devices. Is there any reason we shouldn't relax our policy to let staff work remotely? I'm assuming this would be from their own devices.
The answer is yes. There should be reasons why they shouldn't allow that, but that doesn't mean that there aren't solutions. So just very quickly on home working, because I'm conscious of the time. If you're a mobile worker already with a company laptop, with a company mobile phone, with a data plan on it, you're already a mobile worker, and subject to your work environment at home, you can work from home. Lots of people have a fixed phone on the desk, and they have a PC to do their work. So the government's saying everyone can work from home. If you're a mobile worker, you'll be nodding saying, yes, I can. If you're one of the latter ones, then no, you can't. How do you do that? Hence this question, I think, in terms of using home devices. And you've got to think about the regulatory and compliance environment that you might be in. So can you let people do that from home? You might need to talk to the FCA and say, can I do this? Will you give me an exemption under regulations to allow me to do this? But you've also got to think about the technology. If you've got a remote from home or HTTPS dialing capability, connection capability, but you're putting volume through that like you've never done before, it might actually ground to a halt. So I would say two things: look at your compliance requirements and actually think about volumizing a work from home policy that you've never done to that extent before, because you're probably going to trip over some problems if you do.
Brilliant. And do you know what? I think we've got time for one last question, and we had 2 on this, so I'll grab this one. Any advice or updates on insurance claims for business income protection? I'll leave that with you, Mike.
Gee, thanks. Quick answer: check your policy. You know, at the point that the WHO and government says this is really serious, then the insurance companies, you know, have probably got something to say. Yep, hands up. The government and WHO are saying it, so we'll pay up. But every insurer is going to be different. You need to read your policies, and you need to keep an eye on government and WHO advice.
Perfect. Thank you for that. That takes us to time. I think we have 1 or 2 questions that we've not been able to answer, which we'll do our best to get back to everyone individually on. I'm going to sum up very, very briefly. I think in the preparation for this webinar, one of the things that we've discussed internally, and I think that is really important to us to leave as a message for everyone, that is that it's very, very important to be prepared. All the things that we've talked about already today in terms of making sure everyone is able to work from home, putting in all these preparations now to be ready in case the situation changes. But also this is unprecedented in a lot of ways, and it's a very dynamic, very changing situation. So to be flexible and be prepared to move and shift and change and be able to keep the business working and keep staff safe. Hopefully we've been able to get through as many of your questions as and answer them well for you today. If you have any other questions at all, then obviously please just drop us a line, and we'll do our best to get back to you and run through all of those. Otherwise, I'll say thank you today, and we'll see you the next time. Thanks all.